Today's lesson is on IVF. In this lesson, we will describe how IVF treatment works and the pros and cons of IVF. So what is IVF? IVF, also known as in vitro fertilization, is treating infertility. Some women have difficulty becoming pregnant because they don't produce enough FSH to allow their eggs to mature. Women are given fertility drugs to help them become pregnant. They need extra hormones to stimulate egg production. A doctor could give the woman injections of FSH and LH. So what do these two hormones do? FSH matures more eggs, whereby LH causes more eggs to be released. The hormones will travel to the ovaries through the bloodstream. Now, of course, because they are having injections carry a risk of infection. If more eggs matured, then this would increase the risk of multiple births. Fertility treatments increase a woman's chances of becoming pregnant, although the treatment may not always work. Now, this is one of the disadvantages which we will be looking at shortly. On the other hand, because the treatment boosts the production of mature eggs, it increases the chances of twins or triplets. Multiple pregnancies carry a risk of complications, and again, we will look at these complications later. For example, they may lead to premature or underweight babies. So what is the procedure? Here you have some statements. What I would like you to do is pause the video for a moment and see if you can put these into the correct order. First of all, you should have FSH and LH are given to the mother to stimulate the maturation of several eggs. Secondly, the eggs are collected from the mother, because now there are plenty of eggs. Then they are fertilized with sperm from the father in a lab. Fourthly, the fertilized eggs develop into embryos. It is at this stage one or two of the embryos are inserted into the mother's uterus. As we stated earlier, many couples have to have multiple rounds of IVF treatment. What does this suggest? Again, what I would like you to do is pause the video for a moment and think about, write down what do you think this means if couples have to have multiple rounds of IVF. Looking at the pros and cons. The pros are it gives a woman the chance to have a baby of her own. However, it also means that it has a safe track record and has been used since 1978. The embryos can also be screened for genetic diseases, which is very important for families that already have an affected child. Therefore, only unaffected embryos are used. Another advantage could be unused eggs can be used for research or donated to other couples. Now, there are disadvantages as well, and these include it is a very emotionally and physically stressful procedure. The success rates are not high. It can lead to multiple births, which are risks to both babies and mothers. It can also cause ovarian hyperstimulation syndrome when too many eggs develop into the ovaries. And the success rates, going back to the question on why do some couples have to have multiple rounds of IVF, this is simply because the rates are not always high. There are also ethical concerns with IVF. Some people worry about the ethical implications of IVF. They are concerned that couples may not want designer babies with desirable qualities, so may only want certain fertilized eggs. For example, they may want a girl if they have lots of boys in the family. Also, the embryos are not used. The embryos that are not used may be destroyed. Some people consider embryos to be lives and view their destruction as unethical.